Okay. My name is Leigh Brungardt. I am performing a head-to-toe assessment for Nursing 3293 at Columbus State for their RN to BSN program. I am going to enter my patient's room. I'm going to perform hand hygiene and wash my hands. I'm going to introduce myself to the patient. Hello, how are you doing today?
Good, how are you?
Very good. My name is Leigh. I'm going to be performing a head-to-toe assessment today. Are you having any problems that we need to be more mindful of and pay more specific attention to today?
Nope.
Very good. If at any point you become uncomfortable during this assessment, please let me know. We're also taking patient privacy into account and keeping all body parts covered at all times. Prior to the patient arriving, we assessed his vital signs. Today, his blood pressure was 128/73. Pulse was 83. Respiration rate was 14. His temperature was 98.7. He weighs 215 pounds and is 5'11", 71 inches. And can you please tell me your name and date of birth?
Brandon Brungardt, September 18th, 1988.
Very good. And do you know where you are right now?
Yes, I'm in the hospital.
Very good. And do you know what day of the week it is?
It is Saturday.
Very good. So we just assessed Brandon's orientation. It was using the Glasgow Coma Scale. He's alert and oriented to person, place, and time. And he responds appropriately to conversation and is able to introduce himself. So Brandon, when we perform a head-to-toe assessment, I like to start from head to toe. So I'm going to start with your skin, head, and nails first. So I'm going to start with Brandon's head. I'm going to take a look at his hair. I'm palpating his scalp for any tenderness or lesions or abnormalities. And is it tender when I palpate, Mr. Brandon?
No.
Very good. Hair is even. It is covered fully. I don't see any balding. It is slightly gray at the sides. I'm going to come down and take a look at Brandon's skin. It appears to be even. Skin. There's no perspiration. It's dry. It's warm. It's smooth. Skin tone is even and appropriate for his ethnicity. Mr. Brungardt, do you have any problems with your skin?
No.
Have you noticed any moles that have changed shape or size?
No.
Oh, very good. Have you been diagnosed with any diseases pertaining to the skin?
No.
Okay, very good. I don't see any nevi or vascular problems such as varicose veins on his arms. There appears to be no edema as well. And so there's no cyanosis, pallor, or erythema. The skin on his arms the hair on his arms is also evenly distributed. I am going to also assess Brandon's nails. Can I see your nails? They are clean. They are filed evenly across. The cuticles are intact. There's no redness or swelling around the nails. And the capillary refill is less than 3 seconds and brisk as well. There also appears to be no tenting, and the elasticity is very good as well. So now we are going to move on to Brandon's head, neck, and throat. So first I'm going to inspect. Brandon's head is midline to his body. It is symmetrical and not too large for his body as well. And his eyes, nose, and mouth are symmetrical. I am going to assess his, next I'm going to assess his facial movements. They seem appropriate for conversation. I'm going to palpate his temporal artery. And it is easily palpable bilaterally. I'm also going to listen to bruits of his temporal artery with the bell of my stethoscope. I am not able to auscultate any bruits, which is always a good sign. I'm also going to assess the range of motion of Brandon's neck. Brandon, can you turn your head left to right for me? Very good, and up and down. And here I'm going to assess Brandon's cranial nerve 11, which is his accessory nerve. So by doing this, I'm going to ask Brandon to turn his head towards my hand. Very good. Very good. And shrug his shoulders against my hands as well. Very good. Accessory nerve, cranial nerve 11, the accessory nerve appears to be intact with no deficits noted. I'm going to come behind Brandon and I'm going to palpate his trachea and his thyroid. And I'm going to ask Brandon to swallow. And his trachea and thyroid rise evenly when he swallows. Do you have any difficulty swallowing?
No.
Very good. I am going to palpate his carotid artery. And it is easily palpated as well. And I'm going to also listen for bruits on Brandon's carotid arteries with the bell of my stethoscope. I'm also going to listen to bruits for bruits on Brandon's thyroid. Brandon, when I assess your thyroid for bruits, can you hold your breath for me?
Yeah.
Okay. And go ahead and hold your breath. And you can breathe again. I am not able to auscultate bruits on Brandon's thyroid either. Next, I'm going to move on. I'm going to assess Brandon's lymph nodes. And first, I'm going to assess his. Brandon, I'm going to palpate for your lymph nodes. I shouldn't feel any, but if you feel any tenderness when I palpate, please let me know. So I'm going to palpate with his post-auricular, pre-auricular, his occipital lymph nodes, his submandibular lymph nodes, submental lymph nodes, his superficial cervical lymph nodes, his deep cervicular, and his supraclavicular lymph nodes. And I was not able to palpate any lymph nodes, so no lymphadenopathy appears to be noted. Moving on, while I'm assessing his head and neck, I'm going to test for cranial nerve 5, which is the trigeminal cranial nerve. And to do this, I'm going to ask Brandon to close his eyes. And when he feels this cotton Q-tip against his cheek, I would like him to let me know. So Brandon, just let me know whenever you feel it, okay?
Feel it.
Very good.
I feel it.
Very good. So cranial nerve 5, trigeminal, appears to be intact. No deficits noted. I'm also going to assess Brandon's facial nerve, which is cranial nerve 7. So Brandon, can you puff your cheeks out for me? Very good. Can you lift your eyebrows? Very good. And can you smile? Very good. So cranial nerve 7 appears to be intact with no deficits noted. Now I'm going to move on to Brandon's eyes. So first I'm going to inspect. There appears to be no drainage or redness. His conjunctiva is clear. His pupils are round, and his sclera is white. Eyebrows are evenly distributed and symmetrical, and eyelashes are also even and distributed very well. Brandon, do you have any trouble with your vision?
No.
Okay, very good. Do you get eye tests regularly?
Yes.
Very good. It's important to educate our patients to get their eye test. It's now recommended that they do it twice, every 2 years instead of once a year now. Do you know when your last eye exam was?
Probably a few months ago.
Okay, very good. And everything was normal?
Yes.
Very good. So I'm going to assess his corneal reflexes first. So Brandon, I just ask you to look straight ahead for me. Very good. Very good. And Brandon, with only your eyes, I'd like you to follow my pen light with just your eyes. Very good. So pupils are equal, round, reactant to light and accommodation. I'm also going to assess for cranial nerves 3, 4, and 6, which is the ocular motor, trochlear, and abducens nerves, using his EOMs and using his using confrontation. So Brandon, I'm going to use the wagon wheel method for EOM. I'd like you to follow my pen light with just your eyes. And Brandon, with your right eye, let me know when you see my fingers.
See him. See him. See him.
Very good. And on this side.
See him. See him. And I see him.
Very good. So cranial nerves 3, 4, and 6 are intact with no deficits noted. And I'm also going to test with the optic nerve, cranial nerve 2, by asking Brandon to stand up. And we're going to use our Snellen chart to do our eye exam. So if you could just stand behind the line that I've already marked, Brandon. And covering your right eye, can you read this line?
DEFPOTEC.
Very good. And covering your left eye, can you read that same line?
DEFPOTEC.
Very good. So Brandon has 20/20 vision. And that was our distance exam. We're also going to use our near vision. So come have a seat, Brandon. And using this near vision test card, I would like him to hold it straight out in front of him. And Brandon, can you read this line?
LOFPEDOT.
Very good. So Brandon also has 20/20 vision nearsighted as well. That is cranial nerve 2. The optic nerve is intact. So now that we've assessed Brandon's eyes, we are going to move on to his ears, nose, and mouth. I'm going to begin with his ears. I'm going to inspect. Ears are midline and even. No redness or swelling appears to be noted. Brandon, I'm going to palpate your ears. Please let me know if you feel any tenderness. Any tenderness there?
No.
Very good. I'm going to inspect the inside of Brandon's ears with my pen light. There appears to be no redness or swelling in his left ear. No redness or swelling with his right ear. Brandon, do you have any trouble hearing?
No.
All right, very good. So I'm going to assess cranial nerve 8, which is the acoustic nerve. And doing this, I'm going to whisper a simple word in his ear, and I'm going to ask him to repeat it.
8. 6.
Very good. So cranial nerve 8 is intact, no deficits noted. Now I'm going to assess Brandon's nose. Brandon, do you have any trouble smelling?
No.
Have you ever broken your nose before?
No.
Very good. So I'm going to palpate around the nose. Any tenderness?
No.
Very good. I'm going to assess the inside of the nose. There appears to be no redness or swelling. The septum is midline. I'm going to test the patency of Brandon's nose by asking him to occlude his left nostril and blowing in and out of his right. And I'll do the same with his right nostril, blowing in and out. Appears to be a little congestion in that left nostril, but that's normal also. I'm also going to palpate his sinuses from looking for any tenderness. Brandon, if it's tender when I palpate, please just let me know. First, I'm going to start with his maxillary sinuses. Do you feel any tenderness when I palpate?
No.
And his frontal. Any tenderness here?
No.
Very good. So sinuses, there's no tenderness with the sinuses. I'm going to assess cranial nerve 1, which is the olfactory cranial nerve. And to do this, we ask the patient to close his eyes. We're going to put a scent under his nose and ask him to identify it. So, Brandon, can you close your eyes for me?
Mm-hmm.
I'm going to occlude your left nostril and take a whiff. Can you tell me what that is?
Cinnamon.
Very good. And occlude your right. And what is that?
Cinnamon as well.
Very good. So, cranial nerve 1, olfactory, is intact with no deficits noted. So, now we are going to move on to Brandon's mouth. So, I'm going to inspect first his lips. The lips are pink. There appears to be no swelling, redness, chapped lips, or lesions around his mouth. It is midline to his nose and between his eyes and his face. I'm going to inspect the inside of his mouth using my pen light. Brandon, can you open your mouth wide for me and stick out your tongue? All right. Oral mucosa is pink. I am going to test cranial nerve 9 and 10, which is the glossopharyngeal nerve and the vagus nerve. So by doing this, I'm going to ask Brandon to stick his tongue out and say ah.
Ah.
Very good. So the uvula is midline, and the uvula bounces when Brandon says ah, which is positive for the cranial nerve 9 and 10. No deficits noted. Can you also stick your tongue out and move it side to side for me? And up and down. Very good. And that's cranial nerve 12, his hypoglossal nerve. And we're also going to test that nerve by asking Brandon to use his tongue to press the inside of his cheek. And then using my hand on the outside of my cheek, I'm going to ask Brandon to go against it with only his tongue. So, go ahead, Brandon, with your tongue. Very good. Very good. Cranial nerve 12 is intact. That is your hypoglossal nerve. So, now we're going to move on to our breast assessment, and doing this, we're going to educate the patient on how to perform a self-breast exam at home. So, a lot of men don't know that breast cancer is becoming more prevalent in the male population. It's just not talked about as much. So, Brandon, has anyone ever educated you on how to perform a self-breast exam?
No.
Okay. Have you ever had any problems with your chest area?
No.
Very good. So I'm just going to show you quickly how to perform a breast exam. If you have any questions, just please let me know. So when you perform a breast exam, it's best to do it in the shower. So what you're going to do, Brandon, using your left hand, you're going to put it behind your head just like this. And using your right hand, you're going to go around the chest wall, around your breasts. And you're feeling for tenderness or any abnormal lumps. Do you feel anything, Brandon?
No.
Very good. And you're going to do the same with your right hand, and with your left hand, you're just going to go around the chest wall. And anything there?
Nope.
Very good. So patient was able to demonstrate a self-breast exam without any difficulties. Privacy was maintained during that assessment. So now we are going to move on to the respiratory system. And I'm going to first inspect Brandon's respirations and his chest movement when he's breathing. So it appears to have even rise and fall. It is symmetrical. Brandon, do you have any trouble with diseases like asthma? Have you ever had any trouble? Have you ever had respiratory distress before?
Nope.
Okay, very good. So respiration rate is 14. I'm going to assess his lungs by listening. So Brandon, I'm going to listen to your lungs with the diaphragm of my stethoscope. And you're going to take deep breaths in for me through your mouth, okay? If you become lightheaded, please let me know and we'll take a break, okay? Very good. And now, Brandon, I'm going to listen to your lungs posteriorly as well. If you could just lean up for me. And you're going to take deep breaths in through your mouth and if you get lightheaded, just let me know, okay?
Okay.
And I'm using the diaphragm again. Very good. So Brandon's respiration rate is regular and even. His lung sounds are clear to auscultation anteriorly, laterally, and posteriorly bilaterally. So now I'm going to move on to my cardiovascular assessment. And first I'm going to auscultate Brandon's heart sounds using the diaphragm and the bell of my stethoscope. First I'm going to start with my diaphragm. And I'm going to identify the landmarks as well. So Brandon, I just need you to sit and relax for me, okay?
Okay.
So using my diaphragm first, I'm going to assess his aortic, his pulmonic, his Erb's point, his tricuspid, and his mitral. And S1, S2 are clear. And now, using the bell of my stethoscope, I'm going to listen for S3, S4 adventitious sounds and murmurs. So I did not hear any murmurs or extra heart sounds. Everything appears to be normal at the cardiovascular assessment. I've already listened to his carotid and temporal for bruise. I am going to now move down, and I'm going to look for edema and any vasculature problems. So Brandon, I'm going to move down to your feet and legs, okay? So I'm palpating for edema. Pitting edema, which means the patient is basically holding on to extra fluids, which could be a sign of a cardiovascular disease. And I don't appears to be any edema. I don't see any problems with his veins, such as varicose veins. Everything appears to be in good health. I'm now going to assess his pulses, starting from his feet and working up. First, I'm going to start with his posterior tibial, which is behind his ankle. I'm going to assess both. His dorsalis pedis pulses, which are on the top of his feet, bilaterally. I'm assessing his popliteal pulse, which is behind his knees. Brandon, you just put your legs out like that. Very good. And all three of these are easily to palpate bilaterally. I'm going to assess his radial pulses bilaterally. And his brachial pulses bilaterally. And I've already palpated his carotids, but I'll do them again just to be sure. And all pulses are easily palpated. Now, moving on, I'm going to assess his ability for stereognosis, graphesthesia, and point localization. So with stereognosis, I'm going to ask Brandon to place an object in his hand, and I want him to identify it for me with his eyes closed. So Brandon, close your eyes for me. I'm going to place an object in your left hand. Can you tell me what it is?
It's a coin.
Very good. And Brandon, I'm going to draw a number on your left hand with your eyes closed. Can you tell me what the number is? And this is testing for graphesthesia.
2.
Very good. Now I'm going to test point localization using a paper clip. Brandon, the paper clip has a dull and a sharp side. When you feel it on either your legs or your arms, I want you to tell me if it's your left or right leg and if it's dull or sharp. Okay?
Okay.
Close your eyes.
Dull, left leg. Sharp, right leg. Sharp, right arm. Dull, left arm.
Very good. So that assessment was positive. Brandon's able to identify objects with his eyes closed and dull and sharp. Now I'm going to move on to my musculoskeletal assessment. So I'm going to ask Brandon to squeeze my fingers. I'm testing his muscle strength. Very good. I'm going to ask Brandon to hold his arms out like this for me. And I'm going to ask him to pull against me and push against me. And I'm also going to do that with his lower extremities. Brandon, I'm going to go against the tops of your feet. Can you pull up and go down like you're pressing the gas pedal? Very good. And can you go against my hands? And go against my hands again. Very good. Muscle strength is equal and strong bilaterally. I'm also going to assess Brandon's deep tendon reflexes, but I don't have a reflex hammer, so I'm going to use my stethoscope. So first, I'm going to assess his patellar reflexes in his knees. Very good. And just lay him straight down. Very good. I'm going to assess his standing up. And I'm just going to ask you to hang it loosely, limply for me. And his tricep. Very good. Again. And just lay it loose. Very good. And I'm going to assess his bicep reflex also. You can just relax it. Very good. So reflexes are strong and positive. Now I'm going to test Brandon's coordination and balance. So Brandon, can you stand up for me? But first, before we do that, I'm also going to assess Brandon's cervical spine for any scoliosis or kyphosis. So Brandon, I'm just going to ask you to bend over at the waist. Very good. I'm just going to palpate along his cervical spine. And it appears to be straight. I don't see any scoliosis or kyphosis. You can stand up straight again, Brandon. So Brandon, I'm going to ask you to walk toe to heel in a straight line, okay? And we're going to test his balance. And go ahead. Very good. And you can come back. And I'm going to ask Brandon to close his eyes and stand up straight. And close your eyes. I'm looking to see if he's going to moving from side to side. And he doesn't appear to. His balance, and he maintains an erect position. I am also going to, I don't see any abnormal movements there. I am going to now assess his abdominal assessment. So I'm going to ask Brandon to lay on the floor long ways. Brandon, do you have any trouble with your belly?
Nope.
Do you still have your gallbladder?
Yes.
And your appendix?
Yes.
Very good. So first, I'm going to listen to all 4 quadrants with my diaphragm. And now I'm going to listen to his, I'm listening to the arteries in his belly for any bruits also. And those arteries are his renal, his iliac, and his aortic. So first I'm going to assess for the renal, which is located in the upper quadrants with the bell. I'm going to assess his aortic, which is above his umbilicus in the middle quadrant. And his iliac, which is located in the lower quadrant. And I am not able to auscultate any bruits. You can go ahead and stand up for me, Brandon, and have a seat back in the chair. So again, my name is Leigh Brungardt, and I have completed my head-to-toe assessment.